Good morning. This is David Henry. I'm the Communications Manager.
Now, breaking news from KAMR Local 4.
Thank you for joining us here on KMR Local 4 News. The city of Amarillo is preparing to have a briefing about the current coronavirus pandemic. We're taking you live for this breaking news.
Texas Tech University Health Sciences Center. We have Dr. Brian Weiss, Chief Medical Officer at Northwest Texas Hospital. Dr. Michael Lamentier, Chief Medical Officer at BSA. Foy Garza of the Amarillo VA, and City Manager Jared Miller. I want to go ahead and open it up at this time to statements from each member of our panel. We'll start with Amarillo Mayor Ginger Nelson.
Good morning. The City Council will be continuing its recovery roundtable discussions this week. I think we're up to 22 different roundtables, meeting with industry and community leaders to hear their feedback on how to reopen the city in the next shorter period of time, 30 to 45 days. And then also, how do we focus on maximizing our economic recovery? That'll take longer, maybe 18 to 24 months. We will be having a special city council meeting on Friday at 1 o'clock to bring back all of that data and try to formulate action steps from the city's level on what we need to do to answer those two questions: short-term reopening and long-term economic recovery. There's been some confusion since the governor came out with his latest order. Doesn't match the city's order that we have in place. I think there is a difference, the main one being that if you were operating as a low-risk business, the governor has created a more restrictive approach than what we were doing in the city. And that, so if you're operating as a low-risk business, you can no longer allow customers to come into your business. You may remain open. You may bring services out to them, goods. You may sell and place those goods in the car or at the curbside, but they may not come in your store. And that is a more restrictive approach from the governor's office than what we here in the city of Amarillo have been operating under. I think this is a fluid situation. The governor's task force is working as we speak on further guidelines. So stay tuned. I think that could change even as early as possibly the first of next week. But we're watching it. We'll mention it as soon as we know about it. But that is a change, and we will be bringing our order in line with that change unless we get different direction from the governor pretty quickly. Thank you.
Thank you, Mayor. We now want to go to Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center.
Yes, good morning. As always, I'd like to start by reminding everyone to continue to practice social distancing, to wear a mask, and if you have to go out in the public, wash your hands and try to avoid crowds. As reflected in the data, we are continuing to see more cases. This morning's paper, I think, quoted around 360. From my discussion with the health department this morning, there were 311 cases associated with Potter Randall County and 74 outside Potter and Randall County. So that's close to 385 cases. So I remain quite concerned about this, as our doubling rate seems to have not changed significantly. Further, both hospitals are becoming quite busy, and our ventilator use has increased, likely close to half capacity. I'm sure Brian and Michael will comment on this later. And a significant number of those, probably more than 50%, I would imagine, are secondary to COVID cases. Convalescent antibody is continuing to be used by our intensivists. We are starting to receive local donations. We had our first one yesterday. We are grateful for this, and we would like to encourage more of this. The individuals who have received this treatment have improved, and I believe that 2 have been discharged. Finally, I'd like to mention that there's some recent data that seems to confirm what we may have suspected, that outdoor spread of COVID seems to be much less likely than indoor spread. And I would suggest that this should be considered when we're reopening our economy. And I'd like to suggest the city to review ordinances pertaining to this in terms of restaurant and other businesses that may benefit from this. And that's all I have to say. Thank you.
Thank you, Dr. Milton. And I want to go to Dr. Brian Weiss, Chief Medical Officer, Northwest Texas Hospital.
Good morning. Thank you for allowing me to be here. So let me start with the numbers. We've done 506 total tests to date. We've had 90 cases positive out of that. So that's both inpatient and outpatient. Now, with regard to inpatient, as Dr. Milton suggested, we have seen an increase in our capacity of COVID-related cases. So right now we have 64 patients in the hospital who are somehow related to COVID-19. 46 of those are patients under investigation. 18 are confirmed positives. Out of those 18 positives, 10 are currently in our medical ICU. At least half of them are on ventilators right now. And as Dr. Milton said, our concern is we've seen an increased use of our critical care capacity. Right now, about half of our adult critical care beds have patients in them related to COVID-19. And out of that, we're now currently at half of our total ventilator capacity. 75% of those ventilators are being used for COVID-related patients. So that's part of the concern is clearly we've seen the increase in the capacity we're using from last week for COVID-19 patients. We have some very sick individuals in the ICU, and as Dr. Milton suggested, we've used convalescent plasma on 2 of those patients. We've used a drug called tocilizumab, which is a drug used for arthritis on also 2 patients, and we're doing plasmapheresis on some of these patients, all in an effort to try to calm the cytokine storm, which can be part of this COVID-19 infection. Last week we're thinking, things were looking like there was kind of a smolder happening in Amarillo. I think the difference now is our focus is more on the situation in Moore County with JBS there, and also the Texas Department of Corrections. And both those facilities, obviously just due to the confined space, the number of people in them, are potential hotspots for a COVID-19 outbreak. And I know we have seen some more patients coming from both those facilities at Northwest, and I'm sure Dr. Lamentier will comment on what they're seeing at BSA. Last, I'd like to talk about elective surgeries. As Mayor Nelson said, last Friday, the governor loosened some restrictions. One was on elective surgeries. Now, the original plan, the original mandate to stop elective surgeries was to protect the resources necessary for COVID-19, namely hospital beds and personal protective equipment, or PPE. The governor said last Friday that we could start doing elective procedures if we could commit to maintaining resources independent of government resources, namely that we did not require PPE from the government for the rest of the COVID-19 pandemic. At Northwest, we are not comfortable making that commitment yet. So we have not begun elective surgeries yet. We continue to do all the surgeries and procedures that are necessary to keep people from suffering further harm. But at this point, we continue to hold off on elective surgeries until we see further lifting of restrictions by the governor. That's all I have for this morning. Thank you.
Thank you, Dr. Weiss. Now I want to go to Dr. Michael Lamentier, Chief Medical Officer at BSA.
Good morning. Thank you for letting me join the press conference today and provide some details for you at BSA. I'll start off with some statistics as well for our facility in terms of where we currently stand. As of this morning, and these numbers now are changing rapidly, even by the hour, as we're experiencing patients coming in at a more rapid clip at this time. We have 18 positive patients in-house, and we have 16 patients under investigation. That's a total of 34. Of our 18 positive patients, 7 of those are in our intensive care unit. 5 of those are on ventilators. We have 11 of those that are in the med-surg units outside of the ICU. Of our patients under investigation, we have 4 of those patients in the ICU on ventilators. So right now, a little bit less than a quarter of our ICU population is secondary to COVID positivity. But we've absolutely seen an uptick in the number of COVID-related cases over the past several days. We saw 31 patients in our respiratory triage department over the past 24 hours that were concerning for potential COVID at their initial presentation. We are able to do testing now in-house with the reverse transcriptase PCR test on our Cepheid device. This is a huge deal. This allows us to turn around a test within about 45 to 60 minutes when we have a test being done on a patient to rule out COVID. That's part of the reason these numbers are changing. When I first came in this morning, I had different numbers than I just reported to you regarding the PUIs and the positive cases. We are under still an allocation methodology, which is a national allocation based on individuals that have the ability to do this testing, and will continue to be very, I'll say, careful in terms of how we do that test, meaning we're prioritizing that test for inpatients and patients where we must have the answer quickly. Otherwise, we're going to continue with our other sources for testing through the state resources, through Lubbock and also Austin CPL, when tests are being able to be done on outpatients, for instance, that are more stable, and we can turn those around in about a 24-hour time frame. We, at this time, in terms of our surge planning, have converted almost 100% of our ICU beds to negative pressure rooms. We have, in our physical structure in the ICU, 48 beds, and nearly all of them now are negative pressure, which is a major change for us compared to where we were at the beginning of this outset of the outbreak about 5 weeks ago or so. We'll continue to work on our surge planning to be able to go outside the physical walls of the ICU and create ICU beds elsewhere, which we're able to do if needed to accommodate the surge. I'd like to comment also, like Dr. Weiss and Dr. Milton commented on the plasma study. At this time, we've enrolled 5 patients at BSA in the plasma study. As Dr. Milton mentioned, one of those discharges was at BSA, and that patient was doing extremely well. The other patient is still in house, but also is doing extremely well. It is too premature to make conclusions about those patients, but obviously this is early evidence that suggests that this might be a novel therapy that is going to be helpful. And then last thing I'll say is that we have had a lot of press about different drugs and therapies for COVID. I just want to caution the public, the physicians on this call know this, and the physicians in our community know this, but we just do not have good data yet about what the best treatments are for COVID. So the fluctuating reports about Plaquenil and about other drugs that are being tried certainly need to continue, but we're just not going to know for a while when we're going to have good data to say what is effective. Our physicians are doing similar things that Dr. Weiss's physicians are doing with different medications and therapies, which we should continue to do. We just can't make good conclusions yet about any of these therapies. That's all I have today. Thanks.
Thank you, Dr. Lementier. Now I want to go to Troy Garza of the Amarillo VA.
Hi, good morning. As of this morning, the Amarillo VA healthcare system currently has 1 positive COVID-19 case in-house. We also have 1 on home quarantine. And today we have 0 PUIs, although this number does change from day to day, sometimes hour to hour. As mentioned last week, our internal COVID-19 testing capability allows us to get results within 45 minutes, and we've been able to utilize this to obtain baseline screening of 100% of our nursing home residents and staff as a preventative measure to ensure our community living center living space remains a safe home for our most vulnerable veteran demographic. While our veteran positive cases remain low, we are continuing to transition 100% of our face-to-face primary care, mental health, and specialty care appointments to virtual options. Again, this includes telephone or VA Video Connect appointments. Already, we've converted more than 2,800 appointments to this method, and only appointments deemed urgent will be scheduled for an in-person visit. This will allow Panhandle veterans to stay home in accordance with the city's shelter-in-place order, while still having access to the health care they have earned. Based on recent CDC recommendations, veterans who must visit our campus in person should be wearing a cloth mask to slow the spread of the virus and help people who may have the virus and do not know from transmitting it to others. We're also happy to announce that the Office of Mental Health and Suicide Prevention, along with the VA National Center for PTSD and Mobile Mental Health team, has launched a new COVID Coach mobile app to use technology to help combat mental stress during this national emergency. The COVID Coach is designed to help individuals, partners, and families build resilience, manage stress, and increase their well-being during this crisis. The app is free, secure, and helps connect users to important resources for coping and adapting during the COVID-19 pandemic. The app is available on iOS and will soon be available on Android. No email account or password is required to download, and user data is not collected, and this is 100% free. This week, I'd like to take a minute to thank Boom Adventures and the Amarillo Fire Department for teaming up with our Housing First program to provide more than 100 packages of food, which will be delivered to low-income veterans. The support from our veterans and healthcare workers in our community has been absolutely amazing, and I can tell you we sincerely appreciate all the donations, messages of support as we continue battling this virus head-on. As always, should any of our veteran patients be experiencing flu-like symptoms, please call ahead before visiting any one of our facilities at 806-355-9703 and press option 2. Our clinical team will assess your situation and provide you with additional guidance at that point. Additionally, a quick update on our convalescent plasma partnership. We're still working with our Baltimore VA sister facility and the Mayo Clinic on this treatment option for our patients, and we're in the preliminary stages and hope to be able to activate that here very soon. In closing, the Amarillo VA stands ready to assist our community partners, community hospitals, in the event that our fourth mission needs to be invoked to help support the nation during this national emergency. I want to thank Mayor Nelson and the City of Amarillo Public Health Department for allowing us time to speak to our veterans and their families in the Texas Panhandle. Thank you.
Thank you, Foy. At this time, we now go to City Manager Jared Miller.
All right, thank you, Dave. AmarilloAlerts.com. As a reminder, the city recently announced a new emergency notification system to provide current factual information on a variety of events, including COVID-19. We encourage citizens to continue to sign up for the service at AmarilloAlerts.com so that you can stay informed. As of this morning, we have 4,590 people signed up for the alerts. Also want to remind everyone that the drive-through testing center is still open. If you feel sick and have symptoms you think may be COVID, call the public health hotline at 378-6300 to be screened for the drive-through testing center. I want to give a few more updates, as Mayor Nelson said, on the executive order GA-16 that the governor put out recently. This one replaces executive order GA-14, which directed people to let me rephrase. GA-16 still directs people to avoid eating or drinking at bars, restaurants, food courts, or visiting gyms, massage establishments, tattoo studios, piercing studios, or cosmetology salons. So those prohibitions are still in place from GA-14. I'd like to provide some additional guidance on how GA-16 has affected non-essential retail businesses. And this is just to go into a little bit more detail about what the mayor said. While Governor Abbott's executive order GA-14 did not prohibit non-essential retail businesses from operating, GA-16 does specifically place some detailed restrictions and guidance on how non-essential retail businesses may operate. Under the governor's order GA-16, from Friday, April 24th until April 30th, customers may not go into any non-essential retail business. This is per guidance issued by the Department of State Health Services, or DSHS. However, customers may continue to purchase items from non-essential retail businesses for pickup, delivery by mail, or delivery to the customer's doorstep, again, per guidance from the DSHS. The DSHS guidelines also require all employees inside non-essential retail businesses to be wearing a mask. To see the guidance and more information, please visit dshs.texas.gov/coronavirus. The governor has indicated that he doesn't expect GA-16 to be extended in its current form, and therefore it's very likely that it will be modified between now and May 1st. We'll provide more updates as soon as we know more. If you operate a non-essential retail business and you have questions about how to best implement and comply with the DSHS requirements, please call Environmental Health Department at 378-9472. And that's all I have.
Thank you, Jared. This time, we want to go ahead and open it up to our local media to ask questions if they want the entire panel or specific panelists. Feel free to go ahead and do that. This time, let me start with, if I have this correct.
And we'll continue with the coronavirus coverage on air and online. And to keep up with the latest, make sure you log on to myhighplains.com. For now, let's send it back to programming.
I can take that one.
Please.
We don't know the exact date, and that'll be consistent with governor's orders and also our public health authority. So we'll stay in continual contact with Dr. Milton and also pay very close attention to any orders that come out of Austin. So we don't know that exact date yet. We anticipate it would be, forthcoming. But again, it's going to require a lot of input from the public health authority, from our public health department, in addition to additional guidance from the state.
Thank you. And do we know how many tests per day we have available and if those numbers will be able to go up?
So I don't know that I can give you specific numbers, but I think just from my remembrance from looking at the paper from yesterday, I think there's close to 3,000 total tests that we had counted through the health department. So I think those numbers are continuing to go up, and there's availability to test.
Perfect. And now that we know that there's positives in our Amarillo senior facilities, are we testing all residents in those facilities?
So typically, well, what clearly happens when we have any case like that, we do an extensive contact investigation and determine which individuals would be at increased risk for that, and then test those people appropriately.
Okay, so the ones just showing symptoms, basically.
Well, not necessarily. So like one measurement is, well, what's the length of time that they were potentially exposed, and what's the distance? So we look at those types of things.
Okay, thank you. And then for City Manager Miller, Moore County had that curfew, and they did that due to their theft rates going up with car burglaries and home burglaries. Do we know, I know our calls overall are low, but have our thefts gone up also?
Yes, we have some increases in property crimes. We do also have a curfew here in town.
Oh. What is that curfew?
I don't know the exact time. I want to say I'm not going to guess. We'll get that for you.
I can tell you, as the mother of a teenager, it's midnight.
Thank you, Mayor.
That has been in effect for many years, if I remember correctly. If my memory serves.
Many years, and I've used it as a parenting tool.
I was like, what? Okay. For the hospitals, both BSA, Northwest, after furloughing and having physicians go, to hotspots on the East Coast, are we worried about not having enough physicians available during the spike?
Go ahead, Brian.
Oh, thanks, Mike. I would say I'm not aware of having a number of physicians. It's the nursing staff that has gone to the Northeast. We've had a handful of nurses go to the Northeast. And again, we've tried to support them. The idea is that when they come back, we'll have to have a certain amount of quarantine before they can come back to work. But at this point, we are not concerned about having enough staff. But certainly, as Dr. Lamentier noted, things are changing rapidly as we speak. And so there always is that possibility as we try to pull staff back in from the quarantine to help accommodate some of these higher numbers.
Yes, I would comment similarly that I'm not aware of any physicians that BSA physicians at the Northeast, but we had many nurses that did out of a desire to serve and to help our partner hospitals that were very much struggling. And I think it's very admirable that they have done so. We have a protocol, as Dr. Weiss mentioned, when they come back as far as how they can re-enter in a safe manner in terms of appropriate quarantine, and for some testing if needed in terms of any symptomatology or other signs that are concerning. And again, we are not concerned about staffing at this point in the setting of those that are coming back, and we're really kind of shutting down future folks leaving because of the rise in cases we're having now. We can't afford to have our nurses leaving now. So moving forward, that won't be happening. And secondarily, it's also critical that when we were able to, we supported their desire to help others.
Thank you, guys. And then with the outbreak happening in Moore County and specifically at JBS, how do we reduce the infection risk here in Amarillo, as many of those employees work or live in Amarillo and work in JBS or just anywhere in Moore County? Will we implement a mask rule, or with the buses that they have here taking them to work? Is there anything that's changing with that?
I can comment on that. Yes, there have been changes that were put in place that would include increasing the number of buses and spacing out appropriately, giving more distance between the workers. And then cleaning of those surfaces in the buses after each use. Those were all changes that were made that had been put in place when we had a conference with those individuals last week. So we hope that that will help.
Okay.
Mariana, I want to insert here too that much of what is going to control our surge is how fatigued we are getting as individuals with abiding by these guidelines. The physical distancing, our hand washing, our willingness to stay in our homes, if our activities aren't essential for us to be out, those individual choices are what's going to mitigate and truly control the spread in our community. So while we will have hot spots, they will almost always be tied to a situation where we as individuals got tired and impatient. And so we must continue to discipline ourselves, fight against the fatigue of not wanting to live like this. I understand none of us chose this, but we are resilient and we are strong, and we can do this for as long as it takes. So the individual choices that we're making about distancing, about staying home, that's what's really going to impact the spread in our community.
Perfect. And along those same lines, because Moore County is just so close to us, it's right up the road, is making mask wearing mandatory something that's in the topic of conversation?
Well, we've been suggesting, and really strongly so, that if you have to get out in the community, that you wear a mask. In terms of implementing that as an order, that's not been established. And as Mayor Nelson was saying, a lot of this has to do with our individual commitment to being a good citizen and doing those types of practices that are going to reduce the transmission. It's not something that's really a law is going to really make a huge difference, in my opinion. It's really personal behavior and adhering to that.
And I think history has shown that it's virtually impossible to legislate moral and ethical choices. Now, we do it. We have laws against crime and things like that. But what we're really asking people to do is to make the right choice for their neighbors. The best choice is to stay home, because that creates the distance that we need to make sure we don't spread the disease. If you're wearing a mask, that does create a barrier, but doesn't create the same type of barrier as if you had just stayed home. So the best thing to do, the best citizens will choose to stay home, whether they have a shelter in place order, currently in effect or not. The best citizens will consider their neighbors, love their neighbors enough to stay home. The physical distancing choice is the most important one in this equation.
Okay.
Thank you.
Thank you, Ariana. We're going to move on now. If we can, we need to get more media availability here. We have David Gay of the Amarillo Globe News. David, how are you?
Good. How are you?
I'm sorry, David. We lost you there for a minute. How are you?
Good. How are you?
You're back. Sorry about that.
All right. Good. Fantastic. So let's, if I have a couple of questions about the golf course, the announcement regarding golf courses yesterday. Were there any changes that the city saw that that led to the decision being made for the golf courses being reopened on Friday?
Really, the primary guiding factor there was the governor's orders and wanting to be responsive in a responsible way to citizens that were asking to be able to go back to the golf courses. We will evaluate as we go forward how to move forward. When do we turn on golf carts? Things like that. We don't have enough golf carts to be able to run all of our courses with one person per golf cart, and it's violating the social distancing guidelines to run two people in a golf cart. So that's why we're doing walking only, and we'll evaluate that going forward too.
Okay. And then just clarification, because the Clements and Neal units are located in Potter County. Are the numbers from the Texas Department of Criminal Justice regarding coronavirus, are they included in the Amarillo report card?
I believe they are, because certainly with discussions I've had this morning with Carol at the health department, we specifically discussed the inmate concern, and so I believe they are tabulated. Now Casey has the more specific numbers, and so I don't think I can give you specific numbers as of yet.
That's fine. And do any of the medical professionals have any, I guess, advice or recommendations for people in those situations who are, in close quarters where someone may have contracted the virus or have the virus, to prevent spread of a virus in such a small place like that?
In terms of a place where people are confined in their homes, you mean, or
so like the for example the Clements unit, where if someone has a case and there's a lot of people in a small space like that, how to prevent spread of the virus in a place like that?
Yeah, so I've been in discussions with the regional director of the Department of Corrections about that, and they basically instituted a lockdown more than almost 10 days ago, actually closer to 2 weeks ago. So those individuals, I think, in those facilities are confined. I mean, by nature they're confined, but I think they've further been confined to where they can't congregate, and which would be increasing the risk. And I think further they've been trying to cohort some of those individuals, as well as the some of the guards. So there's a lot of changes and thought that's gone into trying to mitigate that.
All right. Thank you guys so much. That's all the questions I have. Thank you, Dave.
Thank you, David. Appreciate it. Let's now go to, I think we have a representative here from Channel 4, KAMR. Aaron, how are you?
Unmute, Jared.
Thank you.
There you are.
There we go. We're going to be looking at tennis courts and pickleball courts, hopefully doing them on the same schedule as we do the golf. It's as much as it is can we do it and stay compliant with social distancing and all the sanitation guidelines, there's also a financial aspect to it. And one of the primary goals there is to make sure that from a financial standpoint, because we are going to be dealing with significant reductions in sales tax revenue and other general fund revenues, we want to make sure that if we open them, that they're going to reduce the amount of loss that we're going to experience this year. In other words, not going to make an additional financial hardship. So with golf, we know that we're going to be able to reduce the financial loss by opening those. We also know that we can do it in a socially responsible way by social distancing, not allowing people to go into the pro shop, not allowing people to go into the food service area, and delivering all services at the curb, just like in the governor's orders. The pickleball and tennis, we're going to have to work through the sanitation challenges there and make sure that we can address them. But from a financial standpoint, they will perform exactly like the golf courses. They will operating them will reduce financial loss that we're going to experience as we go forward. But we do need to address the sanitation issues, make sure we can comply with the social distancing requirements from the governor and DSHS. But once we have those worked out, we will be opening those back up.
I'll start there. So, I know in Moore County, I've talked to some of the doctors up there, and that has really been their test of choice up there at this time. It's both an IgM and an IgG aspect to that test. The IgM really is what they're using to look for acute or new cases. They feel that they had validated that test fairly well before they started using it by comparing it to some of the PCR-based tests. And so they've been reporting those tests as positive, and I believe the state has been accepting those IgM tests as positive. I know up at this point, certainly at our hospital, we have not utilized that test. I know Dr. Bell at Texas Tech has been looking at that test and also working on validation. So I think it was a test that came out quickly. There was some question as to the quality of it, but certainly it's better than nothing. And I think in that sense is what they're finding up in Moore County is that it has proven useful for their application there.
And I'll comment at BSA, understanding what some folks are doing outside of the acute care setting with antibody testing, where there may be a role down the road in terms of how that testing platform is utilized. We do not feel that there's any role for it in the acute care setting at this time. The gold standard really is the reverse transcriptase PCR test to diagnose active infection. There's a weakness in the antibody test if someone's early in the phase of infection where they're not yet mounting an antibody response, and therefore there's a potential false sense of security that someone is quote unquote negative when they are not. So all the physicians on this panel obviously know that, and those doing it in the outpatient setting understand that as well, but there may be a role for that antibody testing at some point in certain populations.
And just for a VA comment, we currently do not provide the antibody tests here, but we are pursuing that avenue to obtain the platform and be able to provide that here in the future.
Mike, do you want to start this side?
Yeah, why don't you go ahead, Dr. Weiss? Go ahead.
Okay. I can't give you exact numbers. I can say that in terms of the TDC, so we have a 4-bed unit that we traditionally have utilized for patients coming from the TDC. We have exceeded the capacity of that unit, which is unusual for us. So we now also have TDC patients in our ICU and on the floor. So in that sense, that's been an increase in the flow of patients from that facility. With regard to JBS, there too, we have several patients in-house right now. And again, that's not normally a common event for us. And so on both fronts, we're seeing increased numbers of patients coming from those facilities.
And I would comment similarly. We have a small number of patients from TDC. We have a larger number of patients that we have received from JBS, and specific numbers at this time I don't have updated this morning, but as Dr. Milton mentioned, and also Mayor Nelson mentioned, certainly we are concerned about any facility where we have close contacts with employees in large facilities that potentially could transmit virus quickly amongst their employees. So we're watching the scenario very carefully. We're giving those patients optimal treatment, and we will continue to do so, as I think both hospitals are ready and willing to do.
Aaron, we have time for one more question if you still have one. Yes, Aaron, we have time for one more question if you still have one.
Well, I know it's last time to speak briefly. So we are using 50% of our ventilators right now. Now, in addition to ventilators, we also have anesthesia machines, which can act as ventilators. So in that sense, we're nowhere near capacity, but certainly we're a little more higher utilization than we've seen the last couple of weeks.
And I would say at BSA, we actually also are at about a 50% vent use currently in terms of our historical capacity, but we have a significant number more events that could be created out of anesthesia machines and BiPAP devices that really would get us to a much higher capacity.
Thank you. And we have one more media member here. We have a representative from KVII Channel 7. If you have any questions for our panel. We have a representative from KVII Channel 7. If you have any questions for our panel, you may ask them now. Going once, going twice, going 3 times. Okay. Once again, that wraps up our news conference for today. This is David Henry. I'm the Communications Manager for the City of Amarillo.